Hello and welcome to True Pathfinder, your portal to health and truth. What do you think this complicated looking schematic here represents? Well, it is the blueprint for the creation of all diseases. And if you stay tuned until the end of this presentation, you will find out what each one of these points signifies and how they all come together to make you sick, and therefore we will be able to understand how we can address any type of disease. So, without further ado, let's dive right into it. In mainstream medicine, stress is generally considered to be of relatively low importance in the genesis of diseases. The genetic dogma and the germ theory prevail. This presentation has been created to help medical staff, but also researchers and just a normal person understand the evidence-based relationship between diseases, stress, adrenaline depletion, a terrain imbalance, the microparasitic invasion, and personal awareness. Any type of successful healing intervention must respect the body's innate intelligence and work holistically with the body according to its self-healing potential and supply also the body-compatible nutrition elements as found in nature. It must also encourage energy production and or provide body-compatible energy and align with the basic natural principles, which are as follows. The body can heal itself. We have a very strong internal self-preserving program that we just need to support. Secondly, the dynamic restorative balance means that reasonable health request for an emotionally beneficial rebalancing act is based on the intelligent design of the human body and its auto-regulation capabilities. Thirdly, diseases result from an insufficient, disturbed self-recovery process and a lack of energy from the natural restorative force. If you cannot bounce back from a biological conflict, an insult, a dispute, or a strong emotion, the first step towards a disease is being taken. Try hard to correct the personal vulnerabilities and thus eliminate imbalances, forgive and forget. This causes that, well, these categorical statements are not only often wrong, but they do distort reality and the understanding of the etiology of imbalances and diseases, as we will see. Also, feeling better does not necessarily mean that you are getting better. Next, the kind of things that bring your life out of balance are mostly invisible. The giant potato pushing you back to the disease is stress, especially psychogenic stress. Also, keep in mind that every part of your body is essential. There are no vestigial organs. However, when organs are removed, we can often still function. Our body always has a plan B to do its intelligent contingency plan for our survival. Higher level of herbal medications might be needed to turn a person around and push their tissue out of the imbalance and prevent a new imbalance state. However, if the unseen psychogenic conflicts and insults remain, smaller dosages must be continually taken to avoid degenerative multiple chronic conditions from developing. A symptom such as pain or dysfunction that manifests at point A rarely originates there. The pain sits in the brain, as we'll see, and an issue is in the tissue, as they like to say. And food carvings are often legitimate attempts of the intelligent body to balance itself out. They are not necessarily evil. As explained in our True Pathfinder concept that you can find on our webpage christine.doctor, The diseasing and the healing process makes sense both from a phylogenetic and an ontogenetic point of view. Humans and mammals, all these conflicts originate from the brainstem and result in cancerous growth, also known as tumors. The old brain controls the organs that emerge from the endoderm, which is the innermost germ layer in our organism, and this was the first system to appear in the embryo. Later, this was covered by the so-called mesoderm and the ectoderm over several million of years of evolution. Dr. Hammer, the father of new medicine, established how conflict shock results in a cold, cancerous or necrotic phase and how conflict resolution reverses the cancerous process and returns the individual to health. Diseases are meaningful biological programs of nature to trigger your attention to solve a conflicting situation that disturbs your body. Diseases and healing processes are divided into 5 phases, all of which can be identified, measured, experimentally observed, and with all of them are also part of a system that makes it possible for us to make precise predictions of events and health developments. A biological conflict shock causes the appearance of focus in the brain, a so-called hammerhead. And this set of concentric rings can be seen in a CT scan. It will show the hammerhead rings centered on a precise area of the brain depending on your condition. The location of the focus depends on the nature of the shock conflict and or the conflict contents. And the organ that is controlled by that specific brain array registers a functional transformation as soon as the hammerhead appears. This transformation can manifest as growth, so tumors, tissue loss, meaning ulcers, or a loss of function, as in the case of diabetes. All diseases must be looked at holistically, and that's what we do at christine.doctor. Link in the description box below, by the way. Contact us and we will help you out in a natural, holistic way. The differentiation between your psyche, the brain and the body is of purely academic nature. The body of living beings is always working holistically. The first criterion is that every disease originates from an unexpected, highly acute and isolating psycho-emotional conflict shock that co-occurs in the psyche, the brain and the corresponding organ. Secondly, the conflict's content determines which organ or function of an organ will be affected and from which area of the brain it will be controlled. We call this psychosomatic events or biological conflicts because they do not work only on the psyche. Thirdly, every biological conflict runs synchronously on the mind, brain and organ level. A biological conflict is an emotionally distressing event we could not anticipate and we were unprepared for. From a biological perspective, unexpected implies being unprepared for that situation, which is detrimental for those caught off guard. To support the organism during this unforeseen crisis, a significant biological special program for precisely that type of conflict is instantly activated in your brain, and the significance of this meaningful biological program of nature is to improve the organ's function so that the individual can manage and eventually resolve the conflict. Severe malnutrition, poisoning, or an injury can result in an organ's dysfunction without the biological conflict. The biological conflict can be seen via CT or MRI as a set of sharp concentric rings or as a semicircle, as shown in the picture here on the right, and where those sharp concentric rings appear depends on the conflict and the organs affected. They are known, as mentioned, as hammerheads or hammer focus. The nature of the biological conflict determines the location of these concentric rings, the hammerheads, and the intensity of the biological conflict depends on the size of the hammerhead. If several physical conflicts run concurrently, more than one hammerhead can be seen on the brain scan, mostly in different phases. By the way, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help the channel grow and spread the truth. Contact us, as mentioned, at christine.doctor for the best holistic care available that you need and deserve, of course, and we will take care of you. And check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links are, as always, also in the description box below. Alright, let's look next at the relation between your psyche, the brain, and the organ. In your brainstem, the control centers of the organs of the intestinal canal and its descendants are all arranged in a ring-form order, starting on the right hemisphere with the brain relays of the mouth and pharynx, the lung alveoli, the esophagus, stomach, liver parenchyma, pancreas, duodenum, small intestine, and then continuing counterclockwise with the brain relays of the appendix, the cecum, the colon, the rectum, and the bladder on the left side of the brainstem, as you can also see in the pictures here on the right. The cerebellum next to the brainstem controls then the so-called skins, so the corium skin, the pleura, the peritoneum, and the pericardium, which protect your body and the vital organs, as well as the breast glands. In the cerebral medulla, the brain relays of the skull, arms, shoulders, vertebrae, pelvis, hip, knees and feet are also all arranged from head to toe. The cerebral cortex is divided into the premotor sensory cortex, the motor cortex, which is responsible for the striated muscles, laryngeal muscles and bronchial muscles. Then the sensory cortex, responsible for the skin, the larynx and the bronchi. The postsensory cortex, responsible for the periosteum, coronary arteries, the coronary veins, the cervix, the rectum surface, the mucosa, the stomach, the bile ducts, gallbladder, pancreatic ducts, renal pelvis, ureters, the bladder and the urethra. And then the visual cortex, that is responsible for the retina and the vitreous body. If you follow us regularly, you often hear us talk about a so-called morsel conflict. So what is it? It refers to how we handle what life throws at us, such as a trauma, unexpected bills, accidents, deadlines, relationships that matter, job losses, financial losses, betrayals, accidental deaths, all the big bad news in our life. And all of these conflicts affect the digestive tract organs, which have developed from the endoderm. When a morsel is thrown at us, we can grasp it with our mouth, swallow it through our throat and esophagus, break it down into pieces in our stomach, separate the good from the deficient in our small intestine, or forgive and let it go in our large intestine and the rectum. So a morsel is an indigestible anger. And we have different types of morsel conflicts. One, for example, is the territorial conflict. That can be a physical or psychological attack with words, fights, weapons, and sensations only of losing territory. This affects the deep skin and the membranes inside of the body that function as protective layers, and this type of conflicts are sudden and unexpected. They can be verbal or physical assaults, both that attack your reputation and the territorial conflict is often perceived as being defiled or touched by something that tarnished you. Organs that have developed from the mesoderm are affected by such biological conflicts. These territorial conflicts violate your territory, your possessions, authority, or social position. In such a territorial conflict, you would lose any of this, such as being assigned a new job with new responsibilities, which you interpret as a territorial loss. Or your neighbor's loud music may be perceived as a territorial infringement. And your inability to find an agreement with them would be a territorial loss of your marked territory. These conflicts affect the ectoderm developed organs and manifest as ulcers, problems in the lining of the ducts and vessels. Next, we have so-called pack conflicts that characterize our relationship with other family members, colleagues, and the pack we rely on in general. This kind of conflict includes mating, nurturing, separation, and divorces. The reason specific conflicts are indissolubly tied to particular brain areas is that during our historical evolution, each part of the brain was programmed to respond instantly to conflicts that could threaten our survival. While the brainstem and the cerebellum are programmed with fundamental survival issues related to breathing, eating, or reproduction, the cerebral medulla and cerebral cortex are encoded with more advanced themes such as territorial, separation issues, identity issues, and self-devaluation issues. When it comes to cancer, it is normally triggered years before you get a diagnosis. And every cancer, like all other chronic diseases, has a different and particular psycho-emotional trigger that is settled in a specific part of your brain where it causes a brain edema. Each brain relay center controls and is connected to a specific organ, and when a doctor states that there is no organic cause, he gives the psychotherapist a free hand to treat the health issues as a psychosomatic condition. This division between the physical level and the psychological level is absurd for a good doctor, because illness cannot be parceled out. The psyche, the brain, and the organs are three levels of your organism, of the same organism, and the course of events on them is always synchronous. Here you can see the affected areas and the specific biological conflicts that are responsible for them. For example, for your adrenal cortex, if you're having problems there, it stems from going in the wrong direction or having the feeling of going in the wrong direction or going astray. Bladder problems stem from ugly conflict, marking territory conflict, or having the feeling that somebody plays dirty tricks on you. Bone problems stem from a lack of self-worth and a feeling of inferiority. Problems with the breast milk glands involve problems that involve care or disharmony. Problems with breast milk ducts stem from a separation conflict. Problems with your left breast stem from a conflict child or home or mother conflict. Problems in the right breast from conflict with your partner. Bronchiolis, territorial conflict. Cervix, severe sexual frustration. Colon problems, ugly indigestible morsel conflict. Problems with your esophagus, you cannot have it or swallow it. Gallbladder problems stem from a rivalry conflict. Heart problems from perpetual conflicts. Intestines, indigestible chunk of anger. Kidneys, feeling like a fish out of water, abandonment conflicts. For the larynx, it's a conflict of fear and fright. For the liver, fear of starvation. For the lungs, fear of dying or suffocating, including fear for someone else dying or suffocating. Lymph glands, loss of self-worth associated with the location. Melanoma, feeling dirty, soiled or defiled. Problems with the middle ear stem from not being able to get some vital information. Mouth problems, the feeling that you cannot chew it or hold it. Pancreas problems, anxiety, anger conflict with family members, for example, inheritance problems. Prostate issues, ugly conflict with sexual connections or connotations. Rectum problems, fear of being useless. Skin problems stem from a loss of integrity. Spleen problems from the shock of being physically or emotionally wounded. Stomach issues from an indigestible anger, conflict and having the feeling that you have to swallow too much. Testes and ovaries, a loss conflict. Thyroid, feeling powerless. Tumor, nursing old hurts and shocks and building up remorse. And the uterus problems stem from sexual conflicts. Each one of these biological conflicts has two phases, the conflict active phase and the healing phase. During the conflict active phase, we feel mentally and emotionally stressed, we are preoccupied with what happened, and as a result we have cold extremities very often, little appetite, suffer from sleep disturbances and can lose weight. When we resolve the conflict, we enter into the so-called healing phase, during which the psyche, the brain and the affected organ can fully recover. Since conventional medicine fails to recognize the two-phase pattern, many symptoms of the repair phase, such as inflammations, fever, painful swelling, pus discharge, blood in the stool and the urine or the sputum, or infections, are often labeled as diseases. However, they are in fact very often natural healing processes of your body. By providing clear scientific evidence that diseases such as cancer do not occur by chance, but as a result of survival programs that have been successfully practiced for millions of years of evolution, we can shatter the dogma of conventional medicine at its core. Questions like, why me? Why did I get a cancer? Become no longer a mystery thereby. Okay, so we've looked now in depth at the psycho-emotional side of diseases, which is very important and can never be overlooked if you truly want to heal yourself. Next, let's see how this psycho-emotional side affects the physical part of your body. Well, this long-term stress created by these unresolved conflicts depletes the adrenaline and breaks down the Krebs citric acid cycle, forcing the cells thereby to replace digestion by fermentation to deal with the rising glucose levels. And this causes a rise in tissue acidity that is also known as acidosis. This changes your whole terrain, of course, and as a result, it awakens the somatids, the microparasites, and changes their life stages. The somatids can pleomorphize, so they can change shape and they can develop into microparasites of the protozoa-type. And if your terrain is unbalanced because you are suffering from acidosis, these microparasites can migrate from the intravascular space, so the capillaries and your red blood cells, into the extravascular space, so they move outside of your veins and into your connective tissue and eventually the stem cells. And these microparasites and many of the pathogens try to solve one problem, namely they try to ferment the glucose and lactic acid excess in your cells. The depleted adrenaline causes the decrease of dopamine and tryptophan levels as well, and this results in a niacin deficiency. And this too contributes to the breakdown of the Krebs citric acid cycle. Depleted adrenaline and high-stress cortisol also lead to a vitamin C deficiency that causes the cell mitochondria DNA to mutate, and as a result you can develop conditions such as cancer. Depleted adrenaline weakens also your immune system and allows the microparasites to conquer the stem cells. And then the stem cells, they try to accelerate the division rate to dilute the number of microparasites per cell. And finally, if they are overwhelmed, they starve, mutate, or die. And if you want to see live video footage of this process going on, I'm gonna link a video down below that we did especially on this subject, on the microparasites and how they pleomorphize and how your stem cells try to deal with them. Prolonged stress also results in a subconscious wish to die, which will shut down the whole body, and as a result, sooner or later you will die. So this mental level is also very important. If you look at the cases of people who have miraculously been able to cure the cancer, they have one thing in common. They also had all of them had a very positive attitude towards life. They never gave up. So cancer and all other types of chronic degenerative diseases start years before you get a diagnosis. Often the trigger is a traumatic psycho-emotional event that you experience as inescapable, as we have discussed. And these toxic emotions will then affect your sleep patterns and deplete your melatonin, for example. While most people can cope with stress relatively well, those susceptible to cancer appear to be highly vulnerable to these stresses and traumas of life and feel unable to cope with what life literally throws at them. These people are often perfectionists and live in fear of conflict, anxiety, trauma, and loss, and are deeply frightened of adverse events. When faced then with significant traumas, the so-called cancer personality feels, of course, trapped and unable to escape from the memory of the traumatic experience and the painful feelings of anger, hate, resentment, and grief associated with that experience. Melatonin is a very important hormone that regulates the circadian rhythm and your sleep patterns. But it does much more than that. It was shown that melatonin also inhibits cancer growth through the ongoing production of interleukin-2. And the interleukin-2 is what controls the white blood cell activity and prevents microbial infections. Melatonin is also the primary hormone responsible for regulating your immune system, and as a result, when there is not enough melatonin, the production of interleukin-1 and 2 is diminished. Interleukin-1 is also very important because it protects against infection, and interleukin-2 regulates the activities of your white blood cells, including the T cells, the B cells, the neutrophils, macrophages, and natural killer cells that are all responsible for your immunity. So when there is insufficient interleukin-2, the stress-induced viral bacterial yeast are free to invade normal cells, thereby damaging the DNA by releasing mycotoxins within the cell nucleus. The American Cancer Society stated, quote, "Melatonin has been shown to slow or stop the growth of several types of cancer cells when studied in the laboratory." The National Cancer Institute Office of CAM states both melatonin and chronotherapy have been studied for many years, but despite largely positive findings, have not been brought into mainstream cancer therapy. As you can already see, all chronic conditions such as cancer are the result of a series of events that are cascading, and they happen on all three levels of your body, on a psychological level, on physical level, and on your mental level, and they're all interlocked with each other. It's like a series of dominoes that fall over one after the other, and therefore all conditions must be looked at holistically and treated holistically. And that's, as I've mentioned, is what we do at Christine.doctor. Again, contact us in the link down below and we'll take care of you. So, in the first phase of the development of chronic conditions, we have often the trigger, which is the psycho-emotional unresolved conflict that depletes your melatonin, as we have explained. And then during phase 2, the next domino stone falls over because as a result of the stress, we have elevated levels of the stress hormone cortisol in us, and this induces adrenaline depletion. We have limited reserves of adrenaline in our body, and when we are under constant psycho-emotional stress, these reserves become exhausted relatively quickly. While insulin is used to transport glucose to the cells, adrenaline is critical for the mobilization of glycogen out of the liver to supply the glucose necessary to overcome the unexpected stress situation. And thereby adrenaline is also responsible for cellular mitochondrial respiration and for the all-important conversion of glucose into ATP energy. Healthy cell division occurs via the metabolic pathway known as oxidative phosphorylation and via the Krebs citric acid cycle of the mitochondria. Adrenaline stimulates the G protein and the GDP molecule and is an essential player in mitochondrial cell respiration, glucose conversion according to the Krebs citric acid cycle, and the metabolic pathway known as oxidative phosphorylation. Without GDP, the cells are forced to ferment glucose. The problem with that is that through fermentation they get a much lower amount of ATP energy via the process known as glycolysis, which creates lactic acid in the cell and an overall acidic environment. The result of that is that a part of the mitochondria perish from the lack of energy, while another part succeed in replacing the irretrievably lost respiration energy by fermentation energy. The fermentation, the energy that is won from the fermentation process is only 2 ATP instead of the usual 36 ATP. And therefore, we can see that cancer patients and other people who suffer from debilitating chronic diseases are very often low in energy and feel really exhausted. A chronically diseased patient also always suffers from acidosis of the tissues. The pH value of the tissue must change from acidic to alkaline to deprive the tumor of a favorable environment to proliferate. And this is easier said than done because all alkaline foods lose their intended effect soon after they enter the bloodstream, as it is used up in the blood for buffering before they can reach the tissue. The body always endeavors via the appropriate regulating mechanisms to maintain the blood pH value at around 7.4, which is essential for the stability of hormones, particularly the adrenaline that we have discussed. If the blood pH value drops, the tissue pH value rises and vice versa. And this means it should be possible to indirectly raise an unhealthy acidic tissue pH by lowering the slightly alkaline blood pH value. The dextrorotatory lactic acid that is constantly produced by exercising and suitable nutrition prevent tissue over-acidification in a healthy organism. And this indicates that optically dextrorotatory lactic acid input would solve the problem. This contradicts the layman opinion that tissue is to be deacidified by administering an acid. But this paradox disappears immediately if all interrelations are understood and kept in mind. For example, acidification of the blood using dextrorotatory lactic acid lowers the blood pH value until both blood and tissue pH reach the same level. And this happens in cancer patients who are administered an appropriate dose of dextrorotatory lactic acid over 5 weeks. From the first until approximately the 4th day in week 5, the acidic substances will be discharged from the tissue into the blood, and the pH value will drop for a short time to shallow values as a result. The excretion of the acidic and pathological substances from the tissue via blood, the liver, the kidneys, and the skin manifests through a pungent and sour smell during this period. The patient also often feels generally unwell and is simultaneously irritable, aggressive, and depressed. At the height of this change-over reaction, that usually lasts only about 3 days, the pH value of the tissue and blood regresses to its normal values. As mentioned, the adrenaline stimulates the so-called G protein, which stimulates the production of the GDP molecule that is essential for the Krebs citric acid cycle, producing the energy molecule GTP to convert glucose into ATP energy during the oxidative phosphorylation. As also already discussed, when the cells go into fermentation, they produce only 2 ATP instead of the normal 36 ATP, and therefore cancer patients and other people that suffer from chronic diseases are often very low in energy. In 1931, Otto Warburg was awarded the Nobel Prize for Physiology for his discovery of the mechanism of mitochondrial cell respiration. He is most famous for his discoveries on cells mutating into cancer cells due to loss of respiration within the cell's mitochondria, which subsequently results in the normal cell fermenting glucose as a secondary means of obtaining energy for the body and the cell. This process of fermenting glucose occurs in the cytosol, or the intracellular fluid of the cells, where it causes a discharge of levorotatory lactic acid. The discharge of lactic acid within the cell creates a very acidic pH environment, and Otto Warburg postulated the cause of the loss of cell respiration sounded most logical to be a depletion of oxygen in the cell. And while this may play a small role, it is in fact the lack of adrenaline, as we know today, that really disrupts the cell's respiration above all else. When an individual is under prolonged chronic psycho-emotional stress, the adrenaline levels initially spike, yet over months and years of perpetual anxiety, the adrenal glands suffer adrenal fatigue, and in many cases the chronic debilitating condition known as adrenal insufficiency develops. In either case, adrenaline production is severely limited. And this is very bad because it is the job of adrenaline to initiate within the cells the conversion of glucose into ATP energy for general bodily use and to provide power for mitochondrial cell respiration. And this is accomplished through adrenaline stimulating the G protein, as mentioned, which subsequently produces or stimulates the production of GDP molecule within the cells. The Krebs citric acid cycle is akin to a large processing factory inside of the cell's mitochondria, and it uses this GDP molecule then to produce the energy molecule GTP. And GTP molecule is used with oxygen to convert glucose into ATP energy through the metabolic pathway known as oxidative phosphorylation. Now, in cancer patients, this Krebs citric acid cycle, that is essential, as we've seen, for optimal oxidative phosphorylation, comes to a halt without the all-important GDP molecule that is stimulated by adrenaline to keep the glucose ATP processing factory running properly, and this causes a buildup of glucose in the cell. How can we remove tissue acidity then? Well, the continued supply of dextrorotatory lactic acid ensures the unproblematic and physiological restitution and maintenance of a blood pH value at 7.4 and a tissue pH value slightly above that. And this will remove a critical precondition for continued tumor growth in a cancer patient, namely the acid environment that we've discussed. Additionally, the kidneys and liver can now carry out their full detoxification functions, laying thereby the foundations for the safe removal of subsequently occurring disintegration products of a malignant tumor. Finally, dextrorotatory lactic acid also causes the biological neutralization of the cancer's toxic levorotatory lactic acid into a non-toxic neutral form. And this is of utmost importance as it removes the stimulus for an increase in the cell division rate. Normalizing the acid-alkali balance also stimulates adrenaline production and improves its effectiveness, which, as we have discussed, is a necessary precondition for a healthy aerobic metabolism. The therapy here offers relatively significant advantages to patients because of the changeover reaction that we have discussed that can be unpleasant, being reduced significantly, and therefore the patients suffer from less stress. This type of therapy is not painful and does not cause vomiting, loss of appetite, bleeding of the bladder, or other similar side effects that are well known in aggressive therapies. Dextrorotatory lactic acid is pretty easy to obtain because it is the main ingredient in whey, which is a liquid component of cottage cheese. Combined with flaxseed oil, it is known as the Johanna Budwig cancer diet. And this diet has saved already many cancer patients' lives and is today promoted as the so-called ketogenic diet often. You also have to stop eating so many carbohydrates and starchy food. A glycolytic environment is associated with an anti-apoptotic and pro-proliferative state that characterizes most solid tumors. The increased entry of pyruvate into the mitochondria by either DCA or inhibition of LDH promotes glucose oxidation, increased apoptosis, and decreased proliferation and tumor growth. Now, as already touched upon, this acidic environment leads to another problem, namely the microparasites. According to Dr. Alfons Weber, the microparasites are the culprits for cancer and all chronic conditions. And as mentioned, we've done a great video with live footage taken by Dr. Weber of the microparasites and their life cycles. And he has proven beyond any doubt that those can be found in all cancer patients, and you can prove it for yourself as well. I explain how in the video that I'm going to link down below. So Dr. Weber discovered what he called potrosa, and they penetrate the red blood cells, or the erythrocytes, where they proliferate and multiply. and then they break and dissolve the capillary vessel walls using their lysosome enzymes. And at this stage, the microparasites invasively migrate extravascularly into the connective tissue, also known as the connective matrix, and the organs. And there they destroy the organ cells, and they invade the stem cells, and this is what leads then to what we call chronic degenerative diseases. This stem cell invasion of this protozoa type microparasites is then met, of course, by our body's defense systems. And the first defense systems of our stem cells is called vacuolization. So they enclose the parasites in small blisters. And when there are too many such blisters, known as vacuoles, when the stem cells become overburdened by a way too big number of these microparasites, the stem cells start dividing to minimize the number of vacuoles within them. And this is known as mitosis, and it leads to hyperplasia, also known as benign flat tumors. Once the nutrients for the parasites kept enclosed in the stem cells vacuoles have dried up, the stem cells start dividing to reduce the number of parasites per cell, and finally, when they cannot cope anymore, they die, also known as cell apoptosis or cell death, due to the toxicity within them and their starvation. And the microparasites that were caught within the stem cells become free again, and depending on the organs invaded and the general patient's health state, the first symptoms appear in the form of skin rashes, eczema, joint problems, lymphatic system problems, inflammations and edemas, all kind of dysfunctions, up to a total shutdown of the organ's functionality. So these microparasites of the protozoa type develop in 4 stages. In the first 2 ones, they are inside of the blood vessels in the so-called protozoa intravascular compensated infection phase and the intravascular decompensated infection phase. Those 2 phases are not very dangerous, but if we suffer from that unbalanced milieu that we are discussing here, they can move into the 3rd stage, the extravascular compensated infection stage, where they migrate from the blood vessels into the connective tissue and the organs, and then finally into the 4th stage, the extravascular decompensated infection stage, where they invade your stem cells. The cancer stages caused by this CA protozoa, if you look at them, are very similar to other diseases caused by microparasites such as malaria, toxoplasmosis, Lyme disease, and the many co-infections of Lyme disease. What are the consequences of this protozoa invasion? Well, your blood quality changes, the viscosity increases, the erythrocytes clump and lose their biconcave shape, the cell's superficial tension decreases due to the changes in the electrical charge, and the oxygen transport is severely hampered. That also leads eventually to cell death. Secondly, the blood circulation is significantly impaired. The infected erythrocytes lose hemoglobin. They go into a so-called anemic state. They also lose glucose, plasma, protein serum, and cholesterol. And all of these substances are now missing in the host metabolism. This is why cancer patients often also suffer from diabetes 2, anemia, or even leukemia, high cholesterol levels, and their globulin values are cyanotic. They are often undernourished, tired, and toxic. The other consequence is hyperplasia. That is boosted to enhance the stem cell division and proliferation and it is followed very soon afterwards by hypoplasia. And leukemia is one of the consequences of blood hypoplasia. The erythrocytes and lymphocyte count diminish, and that cells and cellular debris swim in your bloodstream as a result. The capillary permeability is reduced, and the general capillary circulation is impaired more and more. As a result, the gases cannot be purged out, the oxygen also cannot permeate the capillaries, the blood becomes under-oxygenated, and cellular debris cannot be excreted, which leads to a toxic state. The infected blood plasma leaks out into the connective tissue, so it goes extravascular and into the organs. And when that happens, the protozoa can now infect also the lymphatic vessels and the lymph nodes, the endocrine glands, the cartilages, and the organs. The blood vessels are also either too dilated or too constricted or obstructed. Some can even become entirely blocked, and aneurysms may appear to support the blood circulation. Other side effects of these plasmodial infections are microinfarction, necrosis, obturation, chronic heart insufficiency, heart arrhythmia, valve insufficiency, and it may even lead to heart attacks or strokes. This microparasitic invasion into your lymphatic system also leads to swollen, painful lymph nodes, known as lymphadenitis. How do stem cells proliferate and create tumors when they are infected or overburdened by these microparasites? Well, the mutated cells are the result of the microparasites invading the stem cells. As we have already discussed, to get rid of the parasites, the stem cells start to overdivide. Through this invasion of the stem cells by the microparasites, they lose their correct genetic information eventually, and mutation occurs as a result. When foreign parasitic DNA material interferes with our own human DNA, the proliferation and cellular division are potentiated to save our own DNA and discard the invader DNA. Spontaneous cancer remission is a much longer process than initially thought of, and remissions happen when this parasitic infection has been eliminated. Dr. Weber demonstrated that the disturbances of mitosis in cancer cases are not endogenic and genetically controlled, but exogenic, based on the infectious degree of the hosting organism. Cells may divide, forming new multiple nuclei cells, as is also the case in leprosy or syphilis. And when the body is depleted of nutrients, the mitosis abruptly stops and the cells will die. The brain, blood, and the liver are the most resistant organs in this sense, and the kidneys and lungs the most fragile organs. The first cancer manifestations after the CA protozoa have started their 4 stages of evolution appear on the skin, as mentioned, so look out for exanthemas, rashes, eczemas. They also appear on skin-dependent organs such as the mucosal membrane, the epithelial inlayer, the hair, and the nails. Often observable are also acne, rosacea, psoriasis, scleroderma, and a syphilis skin rash. At the advanced stages of this parasitic infection, you might also notice fever and night sweats, whereby the works are outside and inside of the body. They affect dramatically different organs at this stage, which are now becoming more and more damaged. And as mentioned, Dr. Weber experimentally showed that this CA protozoa can be found in all cancer patients, but also patients with polyarthritis, osteoporosis, rheumatism, kidney and liver disorders, lung conditions, dermatologic conditions, and even psychological and mental conditions. What else happens during the development of chronic degenerative conditions such as cancer? Well, during phase 4, the lack of adrenaline that we've discussed causes dopamine depletion in your brain. Adrenaline is made of dopamine, and as more and more dopamine is being used up during the stress period, the amino acid tryptophan creates serotonin to offset the depressed mood. This, however, subsequently results in a depletion of the tryptophan that is needed to synthesize niacin or niacinamide, also known as vitamin B3, that is vital for cellular respiration. Niacin is converted by tryptophan into NAD coenzymes, which are subsequently used by the Krebs citric acid cycle in the mitochondrial respiration for glucose conversion, cell respiration, and the production of the all-important ATP energy. Without tryptophan and niacin, the Krebs citric acid cycle metabolic pathway is broken. In the 1950s, Dr. Abernhofer, Director of Research at the Regina Psychiatric Services Branch, Department of Public Health in Saskatchewan, Canada, found by accident actually a cancer treatment with high doses of vitamin C and niacin, and he was trying to cure actually psychiatric disorders with this method, but noticed that his psychiatric patients that were also suffering from cancer improved in their cancer condition when he was administering high doses of vitamin C and niacin. And subsequently, he treated hundreds and hundreds of cancer patients in his private practice from 1967 to 2005 using this method, and achieved a documented average life extension of up to 100 months. Cancer patients always suffer from a chronic niacin deficiency that is caused by the chronic tryptophan deficiency. It takes 60 milligrams of tryptophan for the liver to synthesize just 1 milligram of niacin in the body. All tissues in the body convert absorbed niacin into its main metabolically active form, the coenzyme known as NAD, which stands for nicotinamide adenine dinucleotide. More than 400 enzymes in your body require this NAD to catalyze reactions, which is more than for any other vitamin-derived coenzyme. NAD is also converted into another active form, the coenzyme nicotinamide adenine dinucleotide phosphate, or NADP for short. And this happens in all tissues except of the skeletal muscle. Suppose this critical glucose-converting ATP energy-producing factory is shut down. What will happen? Well, we have discussed already what happens. The cell is then forced to ferment these rising glucose levels via the process known as glycolysis to reduce very much lower amounts of ATP energy. Here you can see the difference between the Krebs citric acid cycle of a cancer-free individual on the left and an individual with cancer on the right. And notice that there are many processes that become disturbed, but one of the main keys why they become disturbed is that in a healthy patient, NAD is reduced to NADH. And in a cancer patient, no NAD exists to form the all-important NADH. Why was Dr. Hoffer able to help the cancer patients not only with niacin but also with high doses of vitamin C? Well, during normal cell respiration within the mitochondria, superoxide and hydrogen peroxide damage byproducts of the oxidative phosphorylation. And this must be converted into oxygen and water to avoid further cellular damage. Ascorbic acid, so vitamin C, and enzyme superoxide dismutase are the critical substances used to correct these harmful substances and convert them into oxygen and water to prevent cell mutations. This is the antioxidant effect of ascorbic acid that occurs within normal cells to prevent cancer. The body has ingeniously designed ascorbic acid to have the opposite effect in cancer cells. Instead of being used as an antioxidant to remove superoxide and hydrogen peroxide, it is used as a pro-oxidant to create superoxide and hydrogen peroxide, and this causes cell death in the cancer cells. In a landmark study by the National Cancer Institute in the US, researchers documented this pro-oxidant mechanism of ascorbic acid within tumor cell lines in mouse models. In addition, they found that high levels of intravenous ascorbic acid, vitamin C, can significantly reduce the growth of tumor cells. From the study, given their relative sensitivity, the efficacy of pharmacologic ascorbate administration was examined on the growth of OVCA5, PAN02, and 9L tumors. Treatment commenced after the tumors reached a palpable size of 5 to 7 millimeters in diameter. The xenograft experiments showed that parenteral ascorbate as the only treatment significantly decreased both tumor growth and weight of the tumors by 41 to 53% for OVCA5, which is an ovarian tumor, for PAN02, which is a pancreas, and 9L, which is a glioblastoma tumor cell. In addition, in about 30% of 9L glioblastoma controls, metastases were absent in ascorbate-treated animals. Ewan Cameron, a senior consulting physician at the Vale of Leven Hospital in Scotland and Nobel Prize laureate for his work in chemistry, as well as Linus Pauling, were convinced that ascorbic acid should be included in the treatment of cancer, and they did a 4-year trial to determine the effectiveness of ascorbic acid. It's also known as high-dose vitamin C therapy, and this big study involved 2,860 cancer patients, and it was conducted between 78 and 82. The trial involved a 10-day course of intravenous sodium ascorbic acid, followed indefinitely by 10 to 30 grams of daily oral administration of ascorbic acid. And the results from this big study were again very, very positive. This preclinical data provide a firm basis for advancing the pharmacological ascorbate use in human cancer treatment. The tumor xenograph results are especially noteworthy because ascorbate was used only as a single-agent drug. Pharmacologic ascorbate concentrations decreased tumor volumes by 41 to 53% in diverse cancer types known for their aggressive growth and limited treatment options. The findings showed that pharmacologic ascorbic acid concentrations were cytotoxic to many cancer cells in vitro and significantly impeded tumor progression in vivo without toxicity to normal tissues. Furthermore, the researchers found that the amelioration of ascorbate cytotoxicity in vitro can be added by catalase, and this was consisted among sensitive cancer cells and points unambiguously to hydrogen peroxide generation in the extracellular medium. Hydrogen peroxide cytotoxicity is promiscuous in its action. It compromises membranes, glucose metabolism, and DNA integrity. Variation in sensitivity among cancer cells may be related to the complex networks of hydrogen peroxide and how it acts on combined with a range of functional mutations that are intrinsic to each cancer cell line, which is not present in normal cells. Although the molecular basis for the relative resistance of normal cells remains to be elucidated, the current in vivo data supports the pharmacologic ascorbate concentration, which can readily be achieved in humans, diminished the growth of several aggressive cancer types in mice without causing apparent adverse effects. Although our preclinical mouse data show that tumor growth was significantly decreased, the use of pharmacologic ascorbate as a single agent was not curative. As modalities in cancer are often combined, this data suggests that pharmacologic ascorbate combined with other therapies deserves further exploration for treating cancers that otherwise have poor outcomes, such as pancreatic and ovarian carcinomas, as well as glioblastoma. The proposed mechanism for the tumor-killing actions of vitamin C is that ascorbate distributes from the blood to the tumor extracellular fluid compartments after IV administration. Within the tumor cell, the ascorbate is oxidized to ascorbate radical by a metalloprotein catalyst, which donates an electron to oxygen-forming superoxide radical and ultimately the tumor-killing effector hydrogen peroxide. Vitamin C was first suggested to have cancer-fighting properties in the 1930s already and has been subject to controversy ever since. Despite repeated reports of selective cancer cell toxicity, such as the ones that I've presented to you, induced by high-dose vitamin C treatment in vitro and in vivo models, the exact mechanism of action has remained elusive, and it's still not being used a lot in cancer therapy today. Another important point that is often overlooked and we must discuss, because it is very important, is your mental awareness, your mental attitude during your chronic condition. Your immune system can shut down completely if you have a even subconscious desire to die, caused by the elevated stress hormone cortisol levels that deplete the serotonin and dopamine levels in your brain and thereby can cause severe depression. An individual experiencing an inescapable shock and prolonged chronic stress often feels tired of life and deep down, even subconsciously without being aware of it, wants out of this never-ending struggle and pain, and as a result he sends out subliminal messages to his or her immune system to shut down. This often occurs subconsciously when the immune system receives the orders to stop the production of interleukin-2, production of T cells, B cells, natural killer cells, macrophages and neutrophils. While at a conscious level, the individual with cancer or other debilitating chronic conditions can usually have a strong desire to live, it is at a deeper level of the subconsciousness mind that the individual might feel overwhelmed by the pain and the struggle and send these subliminal thoughts to his or her immune system to shut down. Without the immune system cells, the parasite, bacterial yeast-like fungus that we have discussed of the protozoa type that have pleomorphized within the cells continue to grow and newly created cancer cells continue to multiply. This death wish can be very subtle, and often individuals have mixed feelings and do not even realize they have subconsciously this death wish. This can be further exacerbated by the loss of a loved one or support by the person that is sick feeling unloved and unwanted or rejected. And if this happens, the condition might become unstoppable and uncurable. During cancer therapy, your state of mind, your mental attitude will help make the therapy work or fail. It will heal or kill you. The real commander-in-chief is you, never forget that. And this awareness indicates that the actual final cause of death is related to the death wish. Cancer conditions are prevalent in most human beings. Still, the bodies of those who wish to continue living, who have enthusiasm for life, who are loving and are being loved, these people generally are too healthy for cancerous conditions to become deadly. This awareness also suggests that the death wish is the final death nail. As mentioned, it can be very subtle, and you might have mixed feelings and do not even realize that you have this, but you have to be aware of this and work on this mental issue as well. And again, we address all of these levels in our holistic approach, and we can help you out with that. Contact us at christine.doctor. Link in the description box below as mentioned. During the conflict active phase, your entire organism is geared towards conflict resolution. While a meaningful cell alteration runs its course on a physical level, the psyche and the autonomous nervous system also try to handle this unexpected situation. Switched into a stress state, the mind becomes completely preoccupied with the conflict content. Sleep disturbances and lack of appetite are typical symptoms. Biologically speaking, this is vital because the focus on the conflict and the extra waking hours provide the right conditions for working through the conflict and finding a resolution. The conflict active phase is also called a cold phase because the blood vessels are constricted during stress, and the typical symptoms of conflict activity are therefore cold extremities, particularly cold hands, having shivers and cold sweats. This is a flight and fight sympathicotonic state with the blood, nutrients and oxygen going mostly to the limbs. Thus, there is a scarcity of blood in the visceral organs, the thorax and the brain, that creates acute up to chronic degeneration. The intensity of the symptoms depends on the magnitude of the conflict. If a person dies, for example, during the conflict active phase, it is because of energy exhaustion, weight loss, sleep deprivation, and emotional as well as mental exhaustion. Often it is a devastating cancer diagnosis or negative prognosis that you receive, such as you only have 6 months to live, that throws a chronically ill patient and their beloved ones, for that matter, into a state of despair. With little or no hope and deprivation of their life force, they then waste away and eventually die of cachexia, an agonizing process that conventional cancer treatments only accelerate, unfortunately. If the patient has not undergone any conventional treatment, especially chemo and or radiotherapy, natural healing can be very successful. It can have a very high success rate of more than 90%. It has been shown that with the right holistic natural treatments, after 5 years, 6,000 out of 6,500 with mostly terminal cancers were still alive. With conventional cancer treatments, these figures are generally reversed. The resolution of the conflict signals the beginning of the second phase of the biological program, and our emotions and organisms switches immediately into a healing mode that is assisted by the vegetative autonomous nervous system, which changes into its vagotonia mode. During this healing phase, your appetite will return, but you will still feel fatigued. Extensive rest and supplying the organism with the right nutrients is essential during this phase, as the body is trying to heal. The second phase is also called the warm phase, as during the vagotonia the blood vessels are enlarged, causing thereby warm hands, warm feet and warm skin. So now I hope that you can truly understand what this complicated looking schematic means. It's the blueprint for all chronic conditions. It shows you exactly the whole cascade of events that takes place on your psycho-emotional, on your physical and mental level, and how you can therefore heal all chronic conditions, and how we do this with our unique True Pathfinder concept at Christine.doctor. As a recap, as we've discussed, there is often an initial trigger and psycho-emotional shocking event. This biological conflict affects your limbic system. We can see this in the hammer hertz. As a result, your autonomous nervous system becomes dysregulated. This in turn dysregulates your hormonal system. We see an excess in the stress hormone cortisol. The adrenaline levels are becoming depleted. This leads to melatonin depletion, also interleukin 1 and 2 depletion. The Krebs cycle in general is dysregulated, therefore the cells have to go into fermentation modes. As a result, we accumulate lactic acid, we create an acidic environment. This is ideal for the somatids, the mycotoxins, all these microparasites that we've discussed to pleomorphize, so to mutate, to change and to move extravascularly and to invade your organs and your stem cells, thereby leading to conditions such as cancer and other debilitating chronic conditions. We also see the suppression of the gene p53, NAD depletion, tryptophan depletion, and vitamin C depletion. On an energetic level, we observe energy blockages, symptoms such as sleeplessness and tiredness. The cells also become depolarized. The tissue becomes acidic, and all of this leads to chronic conditions that can be fatal. So, in the right column here, the green column, you see how we can holistically address all of this in order to heal any type of chronic disease, or how we do it, at least in our unique True Pathfinder concept at Christine.doctor. We work on the biological conflict resolution, of course. We can do this through subliminal therapy or EMDR. Then we have to choose the right supplements, nutrition, lifestyle changes. For example, we supplement with melatonin and 5-HTP, niacin, vitamin C. We also work naturally on the deacidification of your body using mostly herbal remedies and essential supplements. For the repolarization of the cells, we love to use galvanic therapy, and by the way, you can get some of the best galvanic therapy devices available on the market today. The Ionotrans devices at vibrantbody.net, link in the description box below. We repair the tissue, we restore organ functionality, and we also work always on the mental level as well, on your subliminal sabotage messages, your subliminal desire to die and to give up. So, that is how we do it here at Christine.doctor. Contact us in the link down below and we will take care of you holistically. With all that being said, I hope that you've enjoyed this presentation. If you did so, please consider supporting us directly by becoming a patron from as little as $5 per month. A link is in the description box below. And also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. Thank you very much for your attention, and until next time, stay healthy.